Ventricular Tachycardia, understanding causes, symptoms, diagnosis and treatment. In our previous lesson, we discussed ventricular fibrillation, a life-threatening arrhythmia. Now, we will talk about another potentially fatal arrhythmia, ventricular tachycardia, or V-Tach, which is a rapid heartbeat originating from the ventricles of the heart. In this lesson, we will discuss V-Tach causes, complications, variations, diagnosis, and treatment. The image provided displays a rhythm known as monomorphic ventricular tachycardia, which is the most common type of V-Tach. Monomorphic V-Tach is described as a regular, rapid rhythm, with similar QRS complexes, that originates from a single ventricular focus. The image provided displays polymorphic ventricular tachycardia, also known as torsades de pointes. Polymorphic V-Tach is described as a rapid rhythm with varying QRS complexes, giving it a twisting appearance. This variation of V-Tach can be caused by a prolonged quart interval, which can be a result of several factors such as electrolyte imbalances and certain medications. Defibrillation is considered the best treatment for pulseless V-Tach. Other treatments may include antiarrhythmic drugs such as amiodarone and lidocaine, and catheter ablation for recurrent V-Tach. It is essential to recognize and diagnose V-Tach promptly to prevent the risk of complications. Refer to the next slide for operations in non-pulseless ventricular tachycardia. V-Tach presenting with a pulse may be treated with the aforementioned antiarrhythmics, or electrical cardioversion. It is important to engage advanced cardiovascular life support, ACLS, guidelines, or basic life support, BLS, guidelines as soon as possible if pulseless V-Tach is observed. V-Tach is generally diagnosed with an electrocardiogram, ECG, but symptomatic diagnosis is also plausible. Symptoms of pulseless V-Tach may include syncope, absence of pulse, respiratory arrest, dilated pupils, cyanosis or unresponsiveness. Symptoms of non-pulseless V-Tach may include rapid heartbeat, angina, dyspnea, dizziness or lightheadedness, syncope or pre-syncope, fatigue, and palpitations. If symptoms such as syncope, respiratory arrest, loss of pulse or cyanosis are observed, basic life support, BLS, and advanced cardiovascular life support, ACLS, guidelines should be implemented immediately. Several risk factors can contribute to the development of V-Tach, including coronary artery disease, myocardial infarction, heart failure, and other structural heart diseases. Other risk factors include electrolyte imbalances, certain medications, and genetic predisposition. To summarize, ventricular tachycardia is a potentially life-threatening arrhythmia that requires prompt diagnosis and treatment. It is a rapid rhythm originating from the ventricles of the heart with at least 3 consecutive beats at a rate exceeding 100 beats per minute. Symptoms may include palpitations, chest discomfort, shortness of breath, and dizziness. Risk factors for V-Tach include coronary artery disease, myocardial infarction, heart failure, electrolyte imbalances, certain medications, and genetic predisposition. Early recognition and intervention are essential to prevent complications and improve patient outcomes. Thank you for participating in this medical department educational video. This video was brought to you by the SCPF Medical Department Medical Student Educational Services.